Good evening to all our listeners and viewers to Global Women Enrichment Podcast. It's our joy to come and be with you in your homes or wherever you are joining us this evening. And today we want to address the issue of World Health. Every year on April the 7th, World Health Day is celebrated globally. And this initiative was started by the World Health Organization, and the first World Health Day was observed in 1949. It started out being on the 22nd of April, but eventually became the 7th of April, established by the WHO, the World Health Organization, because they wanted to have student participation in the initiative to promote global health for all people in all countries. All right, so the initiative first started in 1945 with Brazil and China proposing that there be the creation of an international health organization that was independent of government influence and government powers. So with that, this year, April 7th, 2022, the focus for global health, World Health Day, is universal health coverage. And even as I say that, I see all the controversy going up and the questions and the politics and the rights and so forth. So to start this session, I'm going to pose a question to the rest of my sisters here. I'm going to make a statement, and I'd love you all to contribute in the chat and say what your opinion is. So I'm going to read something, and then I'm going to ask for your opinions. So, health is considered a human right. Everyone should have access to the right care at the right time and at the right place. Let me say that again. According to this theme for 2022, April 7th, World Health Day, with the theme being universal health coverage, health is a human right. Everyone should have access to the right care at the right time and at the right place. Ladies, what do you think of that statement? Share with us and the audience.
Yes, I do agree with you, Sandra, that with that statement, that everyone should have the right to have access to health care when it's warranted. So it should be at the right time and also at the right place. So wherever the health services, whatever facility that person needs healthcare, it should be readily available to them.
What do you think, Laura?
It's funny because as you were talking, I was thinking world, right? And I think so much of our viewpoint is skewed by where we live and how so many do have access based on need, time, and place. Yet, having had the ability to travel to other places where it's just not available. You have to basically travel for a few hours to get healthcare. And I'm not just talking about in countries outside of the U.S. I'm even talking about within the U.S.
Yes.
In some of the rural areas where we think that some of these towns in the U.S. have one doctor for miles and miles and miles. And so when we think about that right, absolutely, we all deserve that right, whether it's the rural U.S., whether it's the mountains of the Dominican Republic, or any other part of this world. We all have the right to health. And sometimes it's really hard to grasp how it is that certain folks don't have that. And I'll even make it personal. As a few years ago, I was a single mom, and my daughter was ill, and I went to the children's hospital, and I'm sitting there, and they're telling me, we won't see your daughter until you pay this amount of money. And I said, I have insurance. They said, yeah, we know, but until you pay this amount of money, we can't let you in. And I said, wait, I thought that this was about first taking care. And they said, yes, but our policy is that we need you to pay this amount just to get in the door. And so I'm sitting there going, okay, I'm going to figure this out. In the meantime, another family walks in with a child literally bouncing off the ground, happy. And they say, my child is very, very sick, and we have no insurance. And that child was taken right in. And yet here I am, I do have insurance, and my child is being denied service because I have to follow the rules of the insurance.
Yes, yes.
So I would tell you in that moment as a mother, my heart's breaking because I'm a single mom trying to figure this out. Luckily, I had friends and family in that moment that could help me. So for me, it becomes personal. It becomes personal because we all have that right to have our child cared for, to have ourselves cared for. And so many times we let rules and regulations get in the way of that. I will even go to the extent of sometimes medical professionals want to volunteer their time, and they can't even do it within our own country because of litigation. And so they'll go and they'll offer their services in other countries where they're appreciated and the litigation is not there. Now, I get it. I'm not knocking the legal system and the rights that we as patients have, because we also don't want to get into, having malpractice. However, sometimes we just need to be cared for. And we need to have a community that embraces that. And we need to look at the rural communities and say, how else can we get care there, whether it's in the United States, whether it's in the Dominican Republic, whether it's in Africa and Europe, wherever it is. We all have that right. So I know I got a little long-winded and personal there. I just believe that we do have the right to care.
Absolutely.
Now, with that comes the responsibility that we do have to care for ourselves.
Okay, now.
Okay? So I'm not saying, hey, let's just put this all on the man, whoever the man is, right? I'm not saying that. I'm saying that we have a role and responsibility in our own care as well. And so I'll stop there because I'm getting a little bit long-winded.
No, that's okay. I think it's pertinent whenever we have our conversations that we get the personal story, because it makes it real. It makes it real for our listeners. It makes it real for the people who are going through it and living it. The single mom out there who hears you says, wow, she went through it too, you know, and they see you now and they see where they were and they know you were there. And I think it makes it real for them. But let me shed a little bit of light on what you said.
Yeah.
I want you to know that half of the world's population do not have access to quality health care.
Yeah.
Half of the world's population. And universal health coverage, as it's focused on this year, means that people should be able to access health services without financial challenges. And, you know, I'm a healthcare provider. And as you remember, last year, summer, I had emergency surgery.
Yes.
And while I'm laying in the bed in pain, I get a call on my phone. You have a deductible.
Yeah.
The deductible is whatever, how much it was. And I said, if I give you all of it today, will you give me a discount? And she said, no, we don't have that here. And I said, okay, then in that case, I'll give you 50%.
Yeah.
So I had my husband pull out the credit card and we paid it. And I thought to myself, what if I couldn't pay that?
Right.
But thankfully, so grateful that I have insurance and I can afford my deductible. And I gave them that amount. And then, I kid you not, I got it back.
Wow.
Because my husband is a pastor. And where we were, let's give kudos to pastoral care. Because he's a pastor, my bill is written off.
Wow.
I'm
That is
blessed,
great.
very blessed.
You are blessed.
You know, and it has to be in that particular facility. If I'm in an outside facility, I have to pay the bill. But if I'm in that particular facility, then that's a perk we get because he's in the ministry. So I lay there and I thought, suppose I couldn't have paid that money today. I wonder what would have happened. And there's so many people that are in that situation who
Yes.
don't have access to health services because they're worried about finances and what will this cost me and will this, deplete my funds. So as we look this year at World Health Day and the issue of universal health coverage, we need to be able to give to people health promotion initiatives. Every human being doesn't have to wait till they're half dead to get care, but we should be able to have people have access to prevention screenings, mammograms, prostate cancer screenings. The most expensive one might be colon cancer screenings. But we do have the one that's not so expensive where they can actually just check for blood in the stool and that can then lead you, because in some European countries that's what is done. They don't go to the colonoscopy first, they do the basic screening first, and if they find blood then we go further.
Got it.
And so people need to have that. They should be able to provide precautionary measures, which is all the screenings. They should be able to have a blood pressure check.
Yes.
And know that you're on the wrong path and we need to do something. They should be able to get treatment if they need it, and they should be able to have rehabilitation and palliative care. People shouldn't have to die with no health care, no
Exactly.
health intervention. It should be accessible and manageable in terms of cost. Now, that leads us to the question of, should healthcare be free of cost to everyone? Is that the idea? Should it be tiered? Is there a tiered health system? The concept of health insurance is something that has protected a lot of us if we can afford it. You have those people who have money, and so they can pay for their health care, and then the majority of us depend on health insurance. And health insurance is a good alternative to having millions of dollars to pay for whatever you want. Health insurance is a good way and a viable way for us to have health coverage. But in the health insurance industry, do you think there is a tiered system?
Oh, I will tell you, there is, my opinion, I had know nothing about the health industry. My opinion, there is some sort of tiered system because as an entrepreneur, having to pay for my own health insurance for a certain period of time, the amount of money that had to come out of my pocket for a premium for the most minimal coverage was ridiculous, I will tell you. Very, very high priced. And when I compare that to the amount that I would pay in a group insurance, it's much lower. I get economies of scale. I get all of that. But when you look at as an individual out of your own pocket, if you want health insurance and what you have to pay for that, it costs a lot of money.
Yes.
So there are, I'm sure, different tiers
Yeah.
that get factored in there.
And it is a challenge. I think health insurance is a good thing. But as you said, the larger companies can subsidize their employees a lot higher than the smaller
Yes.
companies. And then there's the individual who tries to purchase the health insurance on their own and how expensive that is for
Yes.
them. And there are many insurance companies, and I would encourage our viewers, and I know you're looking at me and screaming through the camera, yeah, Sandra, but I can't afford even through the marketplace because I have to pay too much because I make X amount of dollars.
It's true.
And a friend of mine told me recently that if you make over 45,000, you don't qualify for the subsidy in the marketplace. And when you think about $45,000 for a family, if it's a single parent, it's not that much money.
No, and the cost of living here,
Yes.
maybe in a different community, but cost of living here.
What can help us is if we practice preventative.
There you go.
Because preventative is no cost to anyone.
Exactly.
Okay, because of the Affordable Care Act. So you go and get your blood work done, you go and get your mammograms, all of those take all of those preventative measures where you get your health care at 100% covered instead of waiting until, because if you do your annual exams, so many things are found out during those annual exams. That's why it's vital that we get them done. And if you are someone who doesn't go to the doctor until something's happened,
Right.
and then especially if you know that you do not have insurance or group insurance and you cannot afford individual insurance, that's where a lot of unnecessary expenses come into play. So what I would advise you to do is to take advantage of the preventative measures that are out there for everyone.
Yes. So on that note, I want to encourage our viewers, based on what Venoria just shared, is many times you think you cannot go to see a primary care physician because you do not have health care insurance. Let me just encourage you that if you don't have health care insurance, you can be seen by a primary care physician. So find out from your friends who have insurance if you can speak with their doctor. Find out from their doctors, will you see me if I don't have health insurance? Speaking from our personal perspective in the practice I work with, we have patients who pay out of pocket for a visit. And when they come, it's a small fee. We tell them what the labs would cost them, and we have a special price for those who are self-pay so that they don't go to the lab and get this exorbitant bill. And we help to subsidize that cost so that they can get their blood work done. And when it's time to get a mammogram, we have places that offer mammograms free or subsidized, lower cost. And I think the first step is to have that relationship with a primary care provider. Don't just sit and say, I can't afford it. You'd be shocked to know you can afford it. And I won't get into personal things, but the money you are going to spend for a visit to the doctor, if you add up a few cups of coffee that you purchase, you might be able to pay for that visit. And doctors have hearts, and there are some who will actually have you pay even less or even sometimes not charge you at all. And we have had that experience from time to time.
Another thing, I if I may inject here, is pay attention to, especially if you're with a group, meaning company, you have insurance through your company, pay attention to what your benefits are.
Yes.
What you selected. Pay attention to the network of your providers. Because a lot of times you will see that because you did not pay attention to what your benefits are, you just know you have insurance, and you would call a PPO provider and go visit that provider, whereas you are on the HMO, and that PPO provider is not dual, they don't take both HMO and PPO. So therein you're going to end up with a high cost or with no coverage because the provider is non-participating.
Right.
So you just have to be aware as a consumer or as a insured, pay attention to what your insured benefits are.
Yes.
It goes a long way.
So that's for those of you who are insured. We're also talking to you if you don't have health insurance. I'll tell you that 1 in 10 persons in the United States do not have health insurance. And people who do not have health insurance are less likely to have a primary care physician and may not be able to afford the healthcare services and medicines needed. So again, we want to get back to prevention, and this is always going to be my soapbox, that I personally believe that while healthcare and universal health coverage should be a right for everybody, that they should be able to access healthcare at the right time, in the right place, in their community. It shouldn't be all the way over there. While I agree with all of that, I really believe that health is a personal responsibility.
Absolutely.
And so Venoria hinted earlier about prevention doesn't cost anything. Well, that's in the education side of it, because if you think of prevention as mammograms and colonoscopies and blood work and going to get a physical, that costs money. But prevention can go a little bit further than that, where you take responsibility for your health.
Absolutely.
And you eat right.
Exercise.
You exercise. You drink more water and
Yes.
less sugar. And I really, really, really want to tell our audience that in an environment, in a health environment where the cost just seems to be going up and up and up. Listen to this. In 2020, the year of COVID, U.S. healthcare spending went up 9.7%. Call it 10%. You know what that works out to? $4.1 trillion or $12,500 per person. That's crazy.
Yeah.
So the share of the GDP, the gross domestic product, that is going to health spending accounts for 19.7, 20%
That's huge.
of government costs. That is high. You want to hear another truth that blew me away? The U.S. ranked last among 11 industrialized countries on measures of health system quality, efficiency, access to care, equity, and healthy lives. We have the highest cost and we display the lowest performance. That is an awakening, very interesting concept. And it's a rude awakening to all of us that we cannot depend on anybody except ourselves to be healthy. We have a responsibility to know our family history, to know what is going to come down the gene pool to each of us, and to act accordingly. And we cannot overemphasize the need for sunshine, the need for rest, the need for simplicity in life. Don't put yourself in financial stress. I will put a plug for education. Stay in school, get your education so you can get a better job. Those who have better education, the literature is there, the research is there. If you have a better education, you're more likely to get a better job. You're more likely to get a better income. You're more likely to have health insurance. You're more likely to practice health promotion. So we want to encourage education. And I know everybody may not get the higher education. Then let me encourage you to walk. Let me encourage you to stop eating sugar. Don't spend your money on things that are harming you. So having sweet every once in a while is fine. I do not buy juice in my house. I remember the days we used to pay big companies for their juice, and they got rich while I got sugar. So drink water. God made water. It's free to all of us. It doesn't cost you anything to go for a walk in the park. Tell me you can't go to the gym, that's why you don't walk. Find a buddy and go walk in the park. God has given us his beautiful creation to walk in, his beautiful sunshine, so we can get some vitamin D. And stress, let's reduce the stress by simplifying our lives. It's up to you and I to prevent illness so we can promote our health. In a country where so many people do not have access to care, those of us who do have access need to take the lead, set the example. I've had patients who don't have health insurance and they're healthier when they don't have health insurance. And the minute they get health insurance, they're doing all the bad things again. I don't get it. I don't get it, audience.
Crazy.
Why? Why we do that? That doesn't make any sense.
It always happens that way. Always.
We're not taking care of ourselves. It's not the government who is to take care of us. It's not the doctors who are to take care of us. We are responsible for our health.
Well-being. That's
yes.
right.
So in this year, when the WHO is focusing on universal health coverage, in the pandemic, we've seen the government step up 10% increase to make sure most of us have had COVID tests without a cost. Most of us have had our vaccines without a cost. Let's give kudos to the government for providing freely. Some of us recently got kits to test at home, free, no charge. Things like this. Let's be positive about what is positive. Give credit where credit is due, and be grateful. And at the end of the day, as we consider universal health coverage, I encourage us to take personal responsibility for how we lead our lives to stay healthy. Share with us your thoughts in the chat. Send us your comments at gwenrichment.com. We would like to hear your opinions on this concept of health, the right to access health care at the right time in the right place. We wish you health this week as you go along, and we invite you to join us again next week, Saturday, for another podcast. Thank you. Good night.